Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted to be back with you on this beautiful but snowy Tuesday morning. We're broadcasting live with you from the Dolph Simons Family Studio. Today is a special day because it is a call to arms, which you're going to hear a lot more about in just a few moments. But first, we want to mention our vaccine experts who are with us on the program today. Dr. Mario Castro, who is the Vice Chair for Clinical and Translational Research here at the Medical Center, and Dr. Barbara Pahoud. She is the Research Director of Pediatrics and Infectious Disease at Children's Mercy and a vaccine expert. Both of these great folks have been with us before. We are delighted to have them back with us again today. We have a lot to talk about with them, but first, Hawk, how are the numbers?
You know, I think we've had smiles on our faces for the last couple weeks.
We have. Well, weeks is a long time.
Well, after
last
that
couple
102,
that's true.
We've gone down. So we've been very happy about that. The numbers continue to go down, but also the numbers in the Kansas City area are continuing to go on for acute infections. So today we have actually 58 acute infections in the hospital, with 26 of those in the ICU and 20 of those on the ventilator. So a high proportion of our ICU patients are on the ventilator. We still have 68 patients who are in that recovery period. So, but I think overall the numbers are much better than we had seen, 2 to 3, 4 weeks ago, which we are happy about. We would like less and less patients in the hospital, as less as possible. Less is better. But Hays is doing a little bit better too. They have 25 infections as well. 15 of those are active and 10 recoveries. So hopefully they are getting out of their capacity issues and with their proportion of patients. They were up to 40 at one point. So I think they're doing better too.
We are delighted that the numbers are back down a little bit, and we want to see them continuing to fall. We're all a little bit nervous. They're being a Christmas gift to everybody of a lot more. But on the other hand, we also know that we have done a great job of being KC. That is, that we really believe that folks have taken seriously the ICU bed crisis, mask wearing, trying to shelter a little bit more. All those things together make us a stronger community. We think you're pivotal, and you've been a hero for that. Well, Hawkeye, I mentioned that today is a call to arms. And it's kind of a special day for you because I think that it's your turn to get the COVID vaccine, right? The COVID-19 vaccine, right? And it's not, you're not getting yellow fever. You're getting COVID, right, today?
I could take, we could get a couple. We can do how many we want to do.
Your biceps is ready for that.
That's right.
Dana has been kind enough to agree to go through the entire process here on the air with us so you can better understand what to expect. So, Dr. Hawkinson, put your mask back on. We're going to introduce Adam Meyer. Adam is our director of our ambulatory care nursing services, and he is going to help us begin that process. Adam, welcome aboard. I'm going to put my mask back on too because you're coming close.
Absolutely.
So here we go. You've got a mask on. So talk to us a little bit about what's going to happen here.
Yeah. So the first thing that we did was we had Dr. Hawkinson fill out some demographic information that we collect as part of this process under the EUA. And then I'm going to go through and fill out a little bit of information about what vaccine he's getting. Today, Dr. Hawkinson's getting the Moderna vaccine.
All right.
So we'll get Dr. Hawkinson ready. I'll finish up this piece here, and then we'll get his vaccine in his arm.
Okay, excellent.
I would like to say I got a call yesterday from Rhonda, who works up on the 5th floor of Cambridge Hospital.
Yeah.
And she was one of the vaccine hesitant people, but she was so happy that she paged me and told me that she got her vaccine yesterday. So
excellent.
I was happy for her.
Have you been vaccine hesitant at all?
Not after reading the initial Pfizer FDA brief.
Yep. It was really good stuff, and so was the Moderna brief, and the information coming out was outstanding for all of those folks. You're having a little trouble with your clothing.
I know, it's this IFB here. Okay.
Yeah. All right, so the call to arms with Hawkeye getting his first injection here on the air for his first dose of the Moderna vaccine. He'll have another dose in approximately 4 weeks' time. We're pretty excited about that. It is Hawkeye's turn. The way we are doing this is those who have the highest intensity and duration of exposure to COVID-19 are being vaccinated first. And so we've gone through our ICU teams, we've gone through our floor teams, and when I say that, I mean both nursing staff, maintenance staff, janitorial staff, environmental services, dietary, respiratory therapy, social work, and physicians and providers. And then it goes to the people who have less contact. So Hawkeye is an infectious disease doctor, sees a lot of COVID-19 patients still, maybe not every single day, but a lot of days.
Yeah.
And sometime down the list, I'll be in that same position. I don't know if I'm going to take my shirt off on the air, though, Hawkeye. It's a little, it's not as pretty.
They can't go through the
when you're 61.
Yes.
Just saying.
So one of the things that I'm going to give you, Dr. Hawkinson, is your COVID-19 vaccination record card.
All right.
That's from the CDC, and it's got all the pre-printed information on it. And then a couple of questions that I am going to ask you. Are you feeling sick today?
No.
Excellent. And have you ever had an adverse reaction to a vaccine before?
No.
Okay.
And Hawkeye, did you take anything in advance of this shot? A little bit of Motrin or Tylenol or anything? Just
I
in
did
case?
not. I typically don't.
Do you? Okay, so I always do before I get my shots. But I never have a problem with shots.
Whether it's the tetanus vaccine, the yearly influenza vaccine, I don't typically take anything.
And Adam, have we been seeing a lot of problems with vaccines so far with this? Or things been going pretty smooth?
Things have been going really smoothly. Individuals have reported some mild symptoms afterwards, but usually have resolved within the expected 48 hours.
Well, I think this is pretty exciting to watch you
Yeah.
get the Moderna shot on the air, and I don't want you to pass out or
Ready?
anything.
I know,
'cause
I'm
that could be a
trying
bad
not to.
thing.
All right, stick and burn here. 1, 2, 3.
All right, he's surviving it so far, folks. There it
Feels
goes.
good.
Vaccine in.
There you
I was able to go upstairs and see one of our pharmacists, Annie Shelton, drawing up all the vaccine, all the syringes
Yeah.
yesterday. So it's a good
It's
process
a good thing.
and
Awesome.
system they got up there for that.
And now, see, I would get my fingers so tangled in that Band-Aid right now if I was trying to do that, Adam. There's no way I could pull that off, especially with gloves on. So well done, thank you.
All right.
Thank you. Are you feeling okay?
I feel fine. I
Okay.
feel great.
Excellent.
And so,
Thank you.
Adam, we're going to be observing you for a few minutes after this.
Yep.
Is that right?
Yep, we're
'Cause
gonna watch
we
you
watched
for about 15 minutes.
We know
Yeah,
my
yeah.
friend Chris Brown got it. He was one of the first people to receive it, one of the hospitalists who sees a lot of COVID patients, and he did well. And
All right, well, that's pretty awesome that you've been able to get that vaccine right here on the air. So for our public, we are standing by our words. Here's, we have our call to arms.
Yes.
Getting vaccine in order to keep us all safe. All right, we have a really cool discussion, but first, let's see if there are questions from reporters out there.
I have a couple. Joe Chiodo with KCTV5 wants to know, how do you know whether the outdoor dining tent, it's green, can you hear me? Okay, so Joe Chiodo wants to know, how do you know whether the outdoor dining tent at a restaurant is actually doing anything? What's the difference between a tent and eating indoors? Are there things you should be looking for in these outdoor eating spaces to feel safe and comfortable?
Joe, that is a great question. Well done. Hawkeye, are you still functional here with your shot? Do you
I'm
think?
great.
Okay, good deal.
We're doing good.
So I think the question about these outdoor dining tents, if it's really well sealed, it might as well be inside. But if there's more ventilation, even having some of the sides open with heaters and air movement, that feels a little safer, and you still have to keep it pretty de-densified.
yeah, I think putting moving the indoors to the outdoors by putting up one of those tents, it just all depends on the ventilation and how much you can create those turbulent flows like you are more outdoors and less like you're indoors. I think that's the important thing to know. You know, a lot of the tents, it was easier in the spring, the summer, the early fall when you could have whole sides of the tent areas open up. It's probably a little more difficult now with the temperatures when you're probably wanting all four of the walls and then of course the roof of that tent there. I think it's really going to depend on what the spacing is, but also that turbulent airflow that may occur in that area.
So
Okay.
I think that's right. And I think I would just caution our audience, don't be misled because you go outside to eat inside a tent, because like I said, if there's not a lot of airflow, it may be less safe actually
Right.
than in some ways than the inside. Now, generally tents aren't that airtight, but it's really making sure there is a lot of airflow. Here's a fun little test you can do. Just take a little wisp of cotton or something and throw it in the air, and if it sits there and doesn't move around, no airflow. If it starts moving all around, lots of airflow.
Yeah.
That's what you want to see.
Okay. And the second question from KCTV5 is, what is your advice for folks for New Year's Eve? You had advice at Thanksgiving and Halloween and Christmas. What's your advice for New Year's Eve?
Wow, I think New Year's Eve is not going to change, Hawk.
No.
New Year's Eve is traditionally this time for us to get together in large groups and maybe have a little bit of drink and party and have some fun.
Yeah.
But as I know Travis Kelce, I know there's a band that said it first, but said you've got to fight for your right to party. And this year, you have to fight for your right to party. And the fight is to stay away from COVID-19. And we can do that because I really believe that this time next year we'll be having a pretty big New Year's party. And I know we all really want to welcome in 2021 because let's face it, 2020 wasn't the best of years. So 2021, man, that could be a really awesome year. But in order to do that, we want to stay safe.
Mm-hmm. Yeah, I think the message doesn't change. The message has been there since Memorial Day with not meeting in large groups and gathering. The message kind of ramped up as we got to Halloween and the colder temperatures because it was more difficult to do any gatherings at all outside. So that messaging is not going to change. Really keep your bubble as your bubble. Try not to intermingle those bubbles. Not meeting in large groups, not doing those gatherings. It's not just the bars, but we know that it's those gatherings in the households, in those private places. So I think continuing to avoid those is going to be the best bet.
And the last reporter question that I have to have is from a reporter who wants to know what your thoughts are about Catholic-funded charities that are being told that the vaccine is made from a fetus and they should not get the vaccine.
Okay, we addressed this question from an individual last week. It was a great question, but now it seems like it's cropping back up again. You had a good answer, I thought. I think we just need to use the same one.
Yeah, and I was actually talking to the priest at my church, and actually we've had Archbishop Naumann on the show before. He is one of the major contributors to the U.S. Conference of Catholic Bishops, which is the USCCB, that has gone ahead and said it is okay to take these vaccines. If there was any part of or aborted fetuses, those were decades old, and these are in petri dishes in the culture. You are not contributing to that action. It is safe to go ahead and get the vaccines. Not only has the U.S. Conference of Catholic Bishops come out and said that, but the Vatican itself has said that as well. So I would just, again, do the due diligence, do the research, get it from those sources, USCCB or the Vatican websites for those types of issues. If it's other science issues, continue to look at the FDA website, the NIH website, the CDC, the local and state health department websites. Those are sources of truth that you can use. So just understand what the question is and try to find those sources of truth.
Let's see if there's any other reporter questions out there.
Hey, it's Taylor, Channel 41. Good morning, guys.
Hi, Taylor.
I'm afraid this one is going to be dumb, and I apologize in advance if it is. But do we have anything up to date about transmission of COVID-19 to and from household pets?
Oh, that's not a dumb question at all. Actually, it's a really good question. Well done. So, what do you think, Hawk?
I actually was just looking at this yesterday when I was looking at the CDC
spent some time doing
updates.
the same thing as my cat and dog.
Yeah. So we do know that it can spread to other animals. We've obviously seen it in the mink populations.
Yep, ferrets.
We've known it was the tigers at the zoo.
Yeah.
And we know it was home in household pets. They have seen it. It is probably not really transmissible back to humans, but I know that there is the recommendation to really try to avoid pet contact or caring for the pet while you are ill, because we know they can get it, and you never know what sort of recombination or what mutations can arise within those animals, just as the virus can evolve and have mutations in human hosts as well. So I think there is that caution there, but the CDC has some good information about that.
All right. Any other questions? Adam, how are we doing on the timer? He has to stay upright for 15 minutes before you can leave. How much time do we have left
We've
on
got
the
about
meter?
8 minutes left.
All right, so let's flip over to Dr. Castro and Dr. Pahud. We want them to update us on where things are with the AstraZeneca trial and their sense of the country as a whole. Dr. Pahud, let's start with you. How are things going?
Things are going well. Can you hear me okay?
We hear you great.
Okay, great. So we are almost done with enrollment in the AstraZeneca study nationwide. We're about to reach 30,000, and we're probably going to be done enrolling before the end of the year.
That's awesome. Dr. Castro, thoughts on how the trial's gone and just your sense of where the country is with vaccination and these different types of vaccine in general.
Well, thanks, Steve. I think the participation here at KU and in the Kansas City region and in Wichita has been great. We have almost 500 participants here in the vaccine trial. We have hit our targets in terms of enrolling in the elderly. We almost have 30% of our participation here in the elderly population. We've not quite reached our minority targets. We're still working on that this last week or so. But around 16% are in blacks and 15% in Hispanics. I think the response in the community has been great. And, you know, we have participants every day that say, we appreciate what you're doing. This is really going to help us get forward on this pandemic. And I think as we start to see the vaccine distribute out in the community, I've seen personally a lot of people that were hesitant have now become, you know, more positive about it. I think the biggest challenge, though, is in our minority communities, in African Americans and Hispanics, to really understand that this has been well studied, is safe, and is something that you can receive. And we're trying to get that message out there.
How did it make you feel to start seeing the vaccinations from Moderna and Pfizer going into people, being given to patients, or healthcare workers, really?
Yeah, no, this is outstanding. This is exactly what we wanted. It has created a situation with our study where, you know, some of our healthcare workers that we enrolled early on, we've had to unblind in order for them to know, did they get the real AstraZeneca vaccine or not? So we've unblinded a significant proportion of our participants. We've committed to everybody that receives placebo in our study that they'll have access to the vaccine once it's approved. But ultimately, we know we need multiple vaccines available. We need vaccines beyond the Moderna and the Pfizer ones that don't require that ultra-low refrigerator temperatures. And so we need these additional options to get our entire community vaccinated.
Dr. Bahoud, as you study these different types of vaccines, do you have confidence in one kind of or one type of vaccine over another? Or talk to us a little bit about the differences between them.
Yes, absolutely. I have confidence in the one that is going to be offered to you, the one that is closest to you. That's going to be the best vaccine for you at the moment. Now, from the differences between the vaccines, obviously Pfizer, Moderna, messenger RNA, they seem to be very effective. The adenovirus vector vaccines, like the AstraZeneca one that we're trying, I think the importance of that vaccine is that it's going to be the most distributed vaccine in the world. So the research that Dr. Castro is leading here at KU is very important because this is the vaccine that is actually going to help the world get back to normal. Pfizer and Moderna have a very good product. It's going to be very helpful in the developed world, but the developing world needs a vaccine that can be stored easier, transported easier, and the vaccine has already been manufactured in many countries, and it's basically just waiting for the results of this trial that we're doing before it starts getting distributed.
So talk to us why the AstraZeneca vaccine is so much easy to distribute in a part of the world that may be less developed and have less infrastructure.
It's we have experience immunizing people around the world with traditional temperatures, and the world knows how to do storage of vaccines that have traditional methods. And so this vaccine it looks more like other vaccines that we are used to dealing with versus, again, the Pfizer and the Moderna one, as you know, require temperatures that are colder. And the messenger RNA can very quickly disintegrate as soon as it gets injected. It's probably already gone in Dr. Hawkins' arm right now. It gets translated into protein very quickly, and it's very labile. That's why you have to administer in such a strict manner under a certain temperature regulation. So it's really a great product, but it's difficult for us to immunize the entire world with something like this. So that's why the other vaccines are going to come to basically save the world.
Yeah, that's awesome. And so when you think about some of the other, there are also some other types of vaccines besides the adenoviral vector ones, the messenger RNA ones. Talk to us a little bit about some of those other novel ones that are coming down the pipe.
Well, the most novel one is, of course, the messenger RNA. And the way that I like to explain these vaccines is the end result of all these vaccines is to create antibodies against the spike protein. The spike protein is what gives the coronavirus its name. It's the crown piece in the virus. So we're trying to target that crown piece, which is the spike protein, because that's what hooks into the human cell and allows it to get inside. It's kind of like the key to the human cell. So if we're able to get rid of that key and attack it, then the virus cannot attach. So the 3 different vaccines that we have in general are the messenger RNA vaccines, which basically the messenger RNA creates that spike protein inside of your own cell. Your cell then shows that spike protein to the rest of your body, and that's how you become immune to it. Then the adenovirus vector vaccines, the ones that we are currently studying here in Kansas City, you have the genome that will then in your cell translate into messenger RNA and then produce the protein. And then finally, we have protein vaccines where the protein is injected into you.
So lots of different choices. Yeah. Dr. Castro, as we look at trying to get people convinced to take this, we still know that there's about a 35% rate, even here amongst hospital workers, because we've seen that across the Kansas City area from all the different health systems that have been offering vaccine. There's about a third of people that are a little vaccine hesitant. What is it going to take to get folks convinced to do that when you see that even among healthcare workers? And then how do we especially get that message into Hispanic and African American and other minority communities?
Well, those are all great questions and all great challenges. Our approach in both the African American and Hispanic community is to go to those communities, to areas that they trust. And so we have been reaching out to the pastors within the African American community. We have been, Dr. Pahud and myself have been involved with a number of different radio stations, Hispanic radio stations, talking in our language, in Spanish, and communicating that message out there about the safeness of the vaccine. I still hear today people ask me, are we getting injected with a live virus, with coronavirus? And we have to get that message out there that, as Dr. Pahud mentioned, this is not a live virus. This is a protein. This is part of that virus, that little cap of the spike protein that is being injected. So I think it's that reassurance and that message getting out there. And then also I also, as we've had elderly participants in our trials, we talk to them about, talking to their family. They are often, the leaders within their family. And I say, we really need your help in getting that message out to your family, the importance of getting that vaccine to your children, to your grandchildren, and your families, so that they also hear that from you, because you are the trusted source.
Yeah, so important. Okay, I think the clock is ticking. Adam, do you need to come back and check on our patient one more time? Because it's been now, how long? It's been 15 minutes.
15 minutes.
You're still upright.
How are you feeling, Dr. Hawkinson?
Good.
Good.
I feel good.
All right, so we're going to go ahead and get you scheduled for your second dose, since
Okay.
this is a two-part series. And so that puts you on around January 26th.
Okay.
And so is there a time that you would prefer? We've got a wide open day that day.
We can do 7 a.m. or we can do it at
Why
8.
don't we do it right here?
Do it at 8.
Talk
Okay.
to him and see
Sure.
how that's going and how he's
Sounds
feeling.
good.
Get your
What
second
day is
shot.
that again?
January 26th.
That's awesome. That's the day
Yep.
after my birthday.
And I would like to say that, getting the influenza vaccine this year, I did have some soreness for just less than 24 hours. So I wouldn't be surprised if that happens with this one too, but it was nothing. I didn't even need Tylenol or ibuprofen.
Adam, thank you for coming
Thank you,
down.
guys.
Adam Meyer,
Thanks, Dr.
Director of
Hawkinson.
Ambulatory Nursing.
There-
Absolutely.
There is one
so
question
appreciate you
that
being
Adam
here.
might be able to ask. Donna
All
Pittman
right.
wanted to know with Channel 9 News, why is Dr. Hawkinson getting the Moderna? Why did
All right,
he
easy
choose the
question.
Moderna was how she asked it.
Yeah.
Do you want me to answer that?
You can answer.
Sure. So the Moderna vaccine is what we have right now. We got shipments of the Pfizer and the Moderna within about a week of each
We did.
other. And really very quickly started vaccinating our staff and used up all of our Pfizer. And so then we, of course, started administering the Moderna vaccine. knowing that they're both efficacious and both work well. That's the vaccine that Dr. Hawkinson received today.
Yeah, I think it's like one more point to add. We have tried to utilize the vaccines for the patients that are most, for the employees that are most COVID patient facing, and that is the ICUs, the emergency departments, the respiratory therapists, the floors where those COVID patients are. And so those got utilized prior to me getting it. I was certainly a little bit lower down on the list.
Yep. All right.
Excellent.
So, Dr. Castro, as a pulmonary doc, are you going to get a vaccine?
Yes, I've received my first dose last week, and I'm on the wards right now. So I'm very grateful to have received that vaccine and the fine work of the health system to get that out to the community as quickly as possible.
Good. And am I in any trouble right now? I got all my records up to date. Everything I've done, everything I'm supposed to, right? Mario's one of my many bosses here at KU. It's kind of funny. So, well, good.
Back.
So
Steve,
I think,
Steve,
go
we
ahead.
may want to mention an often question I get is, can I get, we've had people participate and get the AstraZeneca vaccine, and then they wonder, oh, can they get the Pfizer vaccine? And so I think it's important to get out to the community that the current recommendation is not to mix the vaccines and only to stick with the vaccine that you are getting. So Dr. Hawkeye there is going to stick with the Moderna vaccine and not reach over and try to get the Pfizer vaccine as the second dose. We just don't know what's going to happen if you do that. We never allowed that in the studies. We don't know what the potential is if you get one full set of vaccinations and you go get another shot, that you may have a heightened reaction to that additional vaccine.
Makes sense. So let me ask you the question that some people may have on their mind, and then we're going to go to our audience questions as well. But with this new variant coming out of Britain, I got a brilliant panel here. What do you all think? Is that going to change any of the things we think about around vaccination? Well, what are your thoughts? Dr. Pahood.
Hi. So the mutations that we've been seeing in South Africa and in the UK have affected parts of the virus, but so far we think that it's not affected the spike protein, which again is the key to getting inside of your human body, of the cell. So as long as that key remains unchanged, the vaccine appears to still be effective. We're monitoring that closely, and if that key changes at all in any way, the good news is it will make it less likely to be able to bind to the human cells, and therefore it'll be less infectious. But if it does mutate and it continues to be an infectious particle, I just want to reassure you that with messenger RNA techniques, we can come up with a new vaccine within 6 weeks, because now all we need to do is reprogram the messenger RNA to code for the new spike protein.
Yeah, that's remarkable. That feels almost like Star Trek. In Star Trek, they just did it in like 6 hours, or at least within an episode. Yeah. So we're getting there. It's getting close. It's pretty close to warp speed now. So Mario, your sense is this is going to be safe. That's not going to create a huge change. What do you see as far as production of the different vaccines? Is it easier to produce a messenger RNA or an adenovirus vector or a protein? What's going to be able to pump out the most vaccines for patients around the world?
Well, I'll briefly answer that, and maybe Dr. Pahood can contribute to it. I think it's not so much the production, because there's a vast amount of these vaccines that have been produced, and the U.S. has committed to additional 100 million doses from Pfizer. So I think the biggest challenge we have right now is the distribution. How to get this out safely into the communities, get people into their appointments, like we did with Hawkeye there, and making sure that they get the second vaccine. Some people are going to say, oh, I got one vaccine, one shot. We know that you need both shots, and that's the important message to get out there.
Yep. So Dr. Pahood, thoughts about the production side. We've talked about distribution. What do you think about the production?
Absolutely. So the fastest ones to produce are by far the messenger RNA vaccines. But like I explained, there's been a lot of countries and a lot of big companies that have started producing the AstraZeneca vaccine, the Oxford vaccine in India, for example, in Brazil. So there's already millions of doses ready to go for when the data gets published and the EUA becomes available for the AstraZeneca vaccine. The ones that take the longest are the protein vaccines because, like I explained, instead of your body creating that spike protein inside of your cells, we need to create them outside. So protein-based vaccines, we know them, we've had them forever, we feel safe with them, but they are very lengthy and it takes time versus messenger RNA. Like I said, within 6 weeks, we could have a brand new vaccine if these viruses mutate.
Pretty awesome. And Hawkeye, you're still feeling good?
Yeah, I feel great.
You haven't passed out or anything?
I have not yet. I haven't swollen up.
Excellent. All right, let's see what questions are out there, Jill.
We have tons of them. Let's see how many we can rock
You
through
bet.
in 15
Let's do it.
minutes, all right? Craig wants to know on the AstraZeneca. He said he understands you can't mix them, but for how long? Like, is he forever going to have to take AstraZeneca if he should get it, or can next year he take Pfizer?
All right, team, what do you think? Team AZ here. Dr. Mahood?
Well, we are actually currently looking at that, and this is something that we've always done in the vaccine world. For example, when the rotavirus vaccines came out, at first we would tell you only to stick to the same product and not to mix and match. But as vaccines get out into the public, clearly mix and matching happens. So we will eventually tell you whether you're able to mix and match or not, but first we need to do the studies to see if immunogenicity changes, if effectiveness changes. Right now, we've studied how these vaccines work when you give them the way that they were studied. Pfizer, 21 days apart, Moderna, 28 days apart. But you know that in life, people are going to do things differently. So that information will be coming, and we will let you know probably within a year whether these products can change. But I do not expect that you'll have to stick to the same product for life. We're saying to complete your series right now, but maybe in a year or two, you may be able to get a different product.
And the AstraZeneca product is how far apart are the two doses?
For us, we're giving them 28 days apart as well, just like Moderna. Pfizer was 21 days.
Jill.
All right, Mary wants to know, are cancer patients on the list to receive the vaccine?
Hawkeye, we got to get those cancer patients immunized.
Yeah, absolutely. We always get the question, is it safe? I have cancer. I'm on chemotherapy. Should I get it? You know, absolutely it's safe. You know, they will probably be in those higher risk groups when the next recommendations come out to get those vaccines. These, again, all look safe. The biggest issue is if you are on chemotherapy, if you don't have a good functioning immune system, will that vaccine give you an immune response to give a protective effect? And that's the biggest issue. And I think some of that can be elucidated when you talk with your physician about what kind of chemotherapy or immune function you may have at that time.
Barb is highly, in all caps, allergic to penicillin and sulfate. Should she get the vaccine?
Hawk, I think it's safe.
Simple answer is yes.
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 Any hesitation from our vaccine panel? Are there, and really, let's follow up that question with this. What are the circumstances that would make you a little nervous about getting a vaccine for COVID-19? Talk to us a little bit about that. Dr. Castro?
Yeah, I think Hawkeye alluded to one, which is in immunosuppressed patients and patients on cancer chemotherapy, we are really know that some of these patients are not able to produce the antibodies that the vaccine is trying to do. So we need to think about alternative strategies for those individuals in terms of social distancing out from their chemotherapy once their immune system is reconstituted. People that have severe allergic reactions, again, this has risen with the Pfizer vaccine. We want to know that ahead of time. We want to be prepared to treat those reactions ahead of time. And ultimately, those individuals still need to be immunized. This is something that we've dealt with for many, many years with allergy shots and other type of shots. We just have to be prepared to combat any allergic reaction, and we have to have the patient, the participant, also know how to recognize that early on and to treat it appropriately.
Okay.
Michelle wants to know, when we get the vaccine, does that prevent us from being vectors and transmitting the virus?
Ooh, what's current thinking on that, Dr. Mahood?
Well, I want to answer something about the allergic reactions.
Please.
The one thing we do know that you could be allergic to is polyethylene glycol, otherwise known as PEG. That is the compound that we are identifying as a culprit that's causing all these allergic reactions that you have heard about in the news for people that have received the Pfizer and the Moderna vaccine. So if you are allergic to that component, you should not be getting the vaccine.
All right, thank you. And follow up to that second part of that question too. Any other thoughts around that? With regard to, the question that Jill just had. You want to hit that again?
I moved on to the next one.
Sorry.
That's all right. The vector. If I get the vaccine, am I a vector?
Are you a vector still?
Yeah.
So what do y'all think, Hawk?
Yeah, I mean, I think there was some signal from the Moderna that you may have had reduced risk of transmission, and I can't remember if at AstraZeneca they had come out with a media brief that they may be able to reduce the transmission, but that is an important part. That is one of the things why we continue to need people, even if you get the vaccine, continue to distance, continue to mask, don't meet in large gatherings, do those types of things. And I'll let Dr. Castro and Dr. Pahud answer more about the AstraZeneca for sure.
So thoughts about transmissibility after you have had the vaccine, Dr. Pahud?
So in the vaccine world, we call this sterilizing immunity. When you receive a vaccine and you are no longer able to become infected at all or carry the disease. With these coronavirus vaccines, so far, they do not appear to be sterilizing. So what that means is, as I explained, if you understand the mechanism of action, we are creating antibodies after you get the vaccine against that spike protein. But that means you can still get the virus, but what we're preventing is that virus from entering the cell. So it's still likely that you could carry it in your nose, for example, and transmit it to others, which is why, as Dr. Hawkins said, we need to continue doing social distancing and masking because there does not appear to be proof yet that these are sterilizing vaccines. The only study that is currently looking and evaluating whether the vaccine is sterilizing or not is actually the AstraZeneca study that we're currently doing. Moderna and Pfizer are looking into it right now, but it was not designed in their original trial.
Gina wants to know, is the vaccine good for kids? And if not, when will children have their vaccine?
Great question. Okay, Dr. Pahud, you're up on that. Batter up.
So if your child is 16 or 17 years of age, they can get the Pfizer vaccine. It has been approved down to that age. But other than that, no child is able to get right now any of the products that has been approved by the EUA. We are in the process of starting the pediatric clinical trials here in Kansas City. And as soon as we have them, we will be happy to come back here and let you know so that we can start recruitment. These studies are probably not going to go as fast as the adult studies, though, so I don't anticipate we'll have a vaccine as quickly as we got it for the adults. But I'm hoping maybe before the beginning of the school year, maybe in the summer, we'll be able to get some vaccines out to children, but it depends on how quickly we gather the information.
And when you say to get a vaccine, we have vaccines. It's whether or not we have the information about whether they work as well in kids and were free of side effects. Is that a fair statement?
Absolutely, because we need to test different doses, half a dose, for example, in babies, like we do with the influenza vaccine. And the kind of studies that we're going to be doing in pediatrics, I've been reviewing those protocols already. And we start with half the dose, and then you go up a second dose, and it's dose escalating studies, basically, where we're still basically in the stage 2. And then we need to do the phase 3 trials to make sure that it's safe and effective. So yes, we still have some ways to go with pediatric trials.
And just as a follow-up to that, we know that that's becoming more of an important issue because of this inflammatory disease that occurs in children after they've had COVID-19. Can you address that a little bit, and how is that going? Are you seeing more of that at children's?
We are continuing to see this disease, MISC, inflammatory illness, that children basically have a very active immune system. And like I was explaining, COVID attaches to this receptor, right, the ACE2 receptor, and children just don't have as many receptors as adults do. And that's why we're not seeing the number of infections in children as adults have them. But the concerning part here is that mutation that we were talking about in the UK and in South Africa, what it's doing is it's making that receptor more, it's making it more likely to attach to the human cell. So the vaccine probably will still work, but the concern we have is that it appears that these infections are going to be more common in children now with this new strain. And if that's true, it highlights again the importance of coming up with a vaccine for children. And more importantly, if you think about this, we've had over 250, 300 deaths in children. That is more deaths due to COVID than we allow for influenza. So this is still a vaccine preventable disease for children. And even if it's taking a bigger toll in adults, we still need to come up with a vaccine for kids.
Yeah, absolutely, especially if we can find out that transmission goes down. And Dr. Castro, a little bit, the long-term effects of this from the pulmonary side of having had COVID-19. We know that's one of the more prominent long-haul symptoms.
Yeah, definitely. We're learning more and more about that long-term complications from this virus. This is unlike any other virus that we've seen. We certainly have seen with other respiratory viruses, in particular influenza, long-term consequences like development of obstructive lung disease, like asthma type features. But we've not seen it to this degree as we have with COVID, where patients have commented to us that have followed up in our COVID clinic really weeks to months out after their initial infection. They're still having symptoms in their chest of shortness of breath, not able to expand their chest, not able to take that deep breath like they used to. And so it is important for our community also to understand if you do have persistent symptoms, do see your physician, do consider, being seen by a specialist in our COVID clinic. That way we can monitor for that and potentially think about down the road what treatments we'll have available. And we're continuing to expand our armamentarium and outpatient treatment for COVID. We've just added in this next phase of the active trial 4 new agents to test for outpatient COVID infections.
That sounds really encouraging. So we'll talk more about that. But first, let's see if there's other questions out there.
Susan wants to know, how effective is a vaccine for people who are carrying extra weight and might be considered obese?
Okay. Team, what do you think? Mario?
Yeah, we've been enrolling participants that have been overweight in these studies. We're going to look at the effect in obese individuals. So far, the preliminary data that we have available appears that it is effective in obese individuals. We just know that when the obese individuals unfortunately get COVID, that it is can severely affect them. But at this point, the vaccine does appear to be effective in overweight individuals.
Yeah, and Hawkin, and the FDA information that went online from Pfizer and Moderna, any comments about folks who had a higher BMI?
Yeah, I don't remember the breakdown of the Moderna and Pfizer in the FDA briefs, but we have to understand too, certainly with antibiotics or things of that nature, we dose it based on kilogram mass, say, 1 mg per kg, or we do that sometimes for steroids too. It looks like for these vaccines, it's a little bit different properties. So you are injecting this known amount of antigen or known amount of substance like the modified RNA, and then your body is really going to take that over to create those antigens, to create those antibodies. So it's a little bit different than dosing for, say, antibiotics or chemotherapy of that nature, but really it looks to be effective, and it doesn't have really anything to do with your BMI, just as Dr. Castro had talked about.
Millie wants to know, is the vaccine safe for pregnant women?
What do you think, Dr. Pahoud? Pregnant women?
So we have some data on pregnant women from the Pfizer study, and at the moment, if you are a healthcare worker and you're pregnant, the recommendation from ACIP is that it's okay for you to get the vaccine. However, obviously, we would prefer to do those studies, and actually, KU, one of our researchers here, is going to do the Pfizer study in pregnant women, and we're going to be helping following up the babies. We've done studies like this in collaboration with KU in the past, where our OBGYNs folks follow the mothers, and then the pediatricians follow the baby. So we'll get more data soon.
Dr. Castro, I saw you shake your head. Did you have anything you wanted to jump in with that?
Well, just the ACOG also came out with a recommendation, again, encouraging providers to have that discussion with pregnant women and to consider going ahead with the vaccination at that point. It is, and I think you've had our Department of OBGYN head here and discuss that as well. So it is something we do encourage them.
And I know Dr. Weineke has been supportive, Hawk.
Yeah, absolutely. Yeah, just as Dr. Pahoud said, the recommendation is if you are in that group that is offered and you happen to be pregnant, you can still get offered and you can still take the vaccine.
Jill.
Joanne wants to know, what happens if there is not enough vaccine for the second time? Can you take it later?
All right, so I think, as I understand, you all comment that when you're getting the first dose, in reserve is your second dose, and that's what we've been told. We're still going to get more Pfizer, more Moderna, and that's earmarked for us based upon our first dose usages. So I don't think that's a concern going on. Anybody have any other thoughts?
You know, I do know that there is at least for the Pfizer, and I would assume for the Moderna too, there is that grace period of, if you have to get it at 21 days, there is that 4-day grace period, either side of that.
I think it's on both of them, yeah, 3 to 4 days.
And then, but once you do, if you miss that second dose, you still need to get that second dose. You don't have to restart the vaccine
it just may
series.
The research won't show you that it's been as effective, but
Correct, yeah.
But any reason to believe, Dr. Pahoud, that it's going to be terribly less effective if you get it, if, you know, let's say you're supposed to get it 3 weeks, you got it 4 weeks or 5 weeks. Does that make it less effective on the second dose?
No, I think in vaccination, again, the principle says you need to be primed with the first dose, and then you need to get boosted. A boosting is a boost, and whether you get it at 21, 28, or 30, probably there's a sweet spot, and that's what they try to study. Pfizer was trying to go for speed. That's why they did 21 days. And Moderna and the other companies went for the traditional 28 days. But I agree with you. It's probably going to be the still effective, whether you get it on time or late.
Our last question today goes to Loretta, who wants to know, since cases are lower, is it safe to be out and about now? Can I go get my hair done, and can I go to my doctor's appointment?
No. Well, it's safe to go out.
Go to your doctor's
You can go out, but I don't.
And do go to the doctor, right?
Go to the doctor. I think the key is that it's better that cases are lower in the hospital. Because even though there's still widespread community transmission, there is less because we're not seeing as many people in the hospital. There was less. Now remember, hospitalization's like 2 weeks behind what's going on in the community. Christmas just happened, so I want you to be careful with that idea. But remember, we were telling you to be careful when we had 17 patients, when we had 30 patients, when we had 40 patients, and even when we had 102 patients. So the rules of infection control have not relented a bit.
No, I agree, 100%. Understand where you're going. Obviously, for the most part, certainly we know here at the health system, your doctor's appointments are going to be safe. There have been systems, protocols in place. We know that most dentists, they have their industry guidance. So going to those places, you need to do that. You need to keep up the routine medical care. We know that, and we've seen these published reports about if you do get your hair done, make sure that your stylist wears a mask and you wear a mask. So there are things you can do to be careful to do those things that need to be done, but just going out and going, to bars, to private parties and things like that, I would say that's probably a no. But doing those other things that need to be done on a day-to-day basis is certainly going to be reasonable to do, taking those precautions that we've been talking about.
I want to say thank you to everybody. This has been a great program. I love having this team on because I don't have to do anything but hand out questions. You guys are so smart. You do such a great job. Final thoughts, Dr. Pahoud.
I think the most important thing is to continue to do all the practices we've been doing, washing your hands, using your mask. Don't go out in public if you don't need to. It's safe to be outdoors and not close to other people, but there's no reason why we need to be pushing the envelope and going to restaurants and indoors and pushing the system. A vaccine is coming. Please be patient, and soon we'll try to get back to normal as quickly as we can.
Dr. Mario Castro, final thoughts.
Oh, just one thing we haven't covered is get your influenza shot. This is the season of influenza. It has been low this year, but it is important. There's just some recent data that actually suggests that getting your influenza vaccine may help you combat against COVID as well. So again, this is something that is important that we get that message out there. Get ready to get both vaccines if you haven't gotten your influenza vaccine already.
So true. And I just want to say, Children's and KU working together is best. That rocks. You guys have rocked this. Thank you so much for the great work you've done. Powerful combination. Adam Meyer, get up here.
Yes.
We want to say thank you to Adam Meyer and all the people who are in our place working hard to deliver vaccination. These guys are working overtime right now. I think we're going to have some pretty cool stuff coming out of all this work with our vaccine plan. We'll be talking more about that over the next few weeks. Adam, thank you. How did he do?
He did great.
Is that
He did
normal? Do
great.
people always do that well with vaccination?
A lot of our teams do that well, and Dr. Hawkinson did great this morning.
Yeah,
so,
he actually did.
yes.
I have to be nice to him for a few
Yeah.
minutes. He did do
Few
great.
minutes.
Yes.
All right. Final thoughts, Hawkeye.
I would like to say thank you to our awesome expert guests. You know, they were extremely helpful and hopefully answered a lot of the public's questions, and especially thank you to Adam. You know, Dr. Williamson, Tim Williamson was leading our vaccine effort here at the health system, and when we needed some operational guidance and things to get moving, once we knew that vaccinations were imminent, he got Adam on board to help that. So he's been an extremely large part of the operations part of the vaccinations.
Yep, that's a big deal because, you know, we got to have the vaccination and then we've got to get it into people, which means there is a call to arms, folks. It's coming to you. Don't squander that opportunity. Don't throw away your shot because you want to get back to normal. Hey, tomorrow we're having a special program. There is a guest, I'm going to say her name, I think correctly, Kiana Thomason, who is the president of Health Forward. She's going to join to talk to us about the barriers to vaccination among people of color and what Health Forward is doing to help mitigate health inequities. That's going to be a really powerful program, just like today's. I want to say thanks to all our listeners out there. And remember, even as we get a call to arms and we get to the chance to be able to take our masks off, which won't be a moment too soon, we still have to mitigate that trail. And how do we do that? How do we take that road correctly? We follow the rules of infection control. Wearing a mask, keep your distance, don't go out if you're sick, cough into your elbow, wash your hands, and most of all, remember, there's still no place like home. We'll see you tomorrow.